Doing MSE purely for cosmetics is asking for trouble. The cosmetic goal should be secondary to a functional goal that you have when doing an MSE. I can guarantee you the MSE is going to increase your nasal airway. It's going to increase your tongue space. It's going to give your tongue room to come up and spread on the roof of your mouth, helping you mew better, helping open up your pharyngeal airway from your tongue falling back into it. That's physics. The MSE makes the box bigger. It's inevitable that it doesn't unless it fails. But what's not guaranteed is that you're going to like what it does to the way you look. After all, aesthetics, to some degree, is subjective. And when it comes to aesthetics, the MSE has some inherent problems that result in many people that I speak to being a little bit alarmed about the way MSE makes them look. Specifically, MSE widens the upper part of their face while not widening the lower part of their face, creating an imbalance, a top heaviness to the face, or what I've often referred to as the balloon face look that's basically a V shape, a narrow lower, and a much wider upper. Now, in my opinion, the balloon face outcome is managed by pre-selecting candidates, by making sure that their lower isn't already super narrow compared to the upper. Because if someone jumps out at you as having a super pointy, tiny little jaw, lower jaw, at the beginning, you're not going to advise that person to do MSE, especially for aesthetics, because you can just see you're going to exacerbate an already existing balloon face. If you're moderate with your MSE expansion, you can mitigate the balloon face outcome, right? So instead of going 10 millimeters, maybe we go 5. And maybe that gets your cheekbones to pop a little bit while sort of striking a compromise between prominent cheekbones and avoiding the balloon face look. But we've got to acknowledge, though, this is really the point I want to drive home with this video. We've got to acknowledge that MSE has some fundamental flaws when it comes to aesthetics. And those flaws are that the MSE is an inherently asymmetric appliance. It expands the upper, but not the lower. And beauty is about harmony. It's about symmetry. It's about balance. MSE throws off that balance. If you could pair it with MSDO and you could widen this and this, widen the chin and the mid-face, you'd be good. But as we know, MSDO is not widely available at all. In fact, it's almost totally not available. The one American provider that I know who does it is Dr. Yusefian. He's up in the Pacific Northwest. Traveling to see him is just not feasible for most people. The other MSDO provider that I know is in Canada, and he's super conservative and will only use MSE and MSDO under very specific clinical conditions that call for it. He doesn't just do it for someone who wants to expand because of mewing or because of I want a wider mid-face. There's got to be a crossbite, or there's got to be probably a diagnosis of sleep apnea, or else he won't even touch you. So for all intents and purposes, MSDO is not accessible for most people. And so when you're going to expand with the MSE, you've got to know and acknowledge ahead of time that this thing is not some aesthetic magic pill. In fact, it's the opposite. It's not an aesthetic magic bullet. It's an aesthetic risk that has to be mitigated. You're putting your face into an imbalance, a top heaviness. Now, MSE's asymmetry is not just top to bottom. It's also left-right versus front-back. When we grow naturally as humans, we grow three-dimensionally. We grow full around, right? MSE, however, is mostly just going left-right, which means that when it expands your cheekbones, it's not taking them three-dimensionally forward and around. It's taking them left-right. So what some people find is that the cheekbones come out the side to some degree and cause a hump around their eye. And this can be a little bit disconcerting for them aesthetically. And Dr. Vaughn actually mentioned this on my interview with him and Dr. Ting a couple of years ago, and at that time I didn't really understand what he was saying, but I've seen it since. He was right. The MSE goes left-right, whereas aesthetic cheekbones have a forward component to them as well. And so let's acknowledge the inherent imbalances and asymmetries with the MSE appliance. It expands only the midface, not the chin and the mandible. And it expands left-right instead of three-dimensionally forward and around. And if we acknowledge the risks that this poses to the aesthetics, we can mitigate that by not overexpanding and also by avoiding MSE if we are purely looking for cosmetic enhancement. MSE is good for aesthetics if the aesthetics are a secondary desire of yours. It's going to give you a Hollywood smile. It's going to improve your smile. But remember, that's just one component of aesthetics. And your mouth is not always open. You have to also look good when your mouth is closed too. And so that's why we need to be concerned about what MSE does to the rest of facial harmony. Objectively speaking, I do think that what MSE does to the cheekbones is a net positive, especially if you don't overdo it. But for people doing it strictly for cosmetics, they tend to be very anal about aesthetics, for lack of a better word. They're nitpicky, hyperfixated on small asymmetries and millimeters of differences in their face that they're trying to change. For that type of person, MSE, I think, is a aesthetic gamble, and I would tread carefully. That's it for now. Appreciate y'all watching. See y'all soon. Peace out.